So if you don't know what frozen shoulder is, I'm so happy for you. Frozen shoulder is called adhesive capsulitis, and oftentimes it is a terrible shoulder problem that has what's called an insidious onset, meaning they don't think they know why it comes on, but they're wrong. I'm Dr. Wendy, I'm a physical therapist, and I have taken care of women for almost 20 years, and frozen shoulder happens because your hormones are shifting within your body. We need your hormones to be optimal to keep all that stuff moving, sliding, and gliding. So think about your shoulder. The reason it stays together, in addition to your muscles, is it has something called a shoulder capsule. Envision the capsule as saran wrap surrounding that whole shoulder joint. Now, your ligaments are just thickenings of that capsule. So you have a hormone issue. Let's say you're a female, say you're menopausal, postmenopausal. Add in the fact that maybe you smoke. Add in the fact that maybe your thyroid's off. Okay, those hormones help keep those tissues pliable, hydrated. So if you have a chemistry issue happening for whatever reason, this area can then, like a shrinking ink, shrink on down and cause you problems. Adhesive capsulitis. This is why it happens more in women than men. Now, usually they say it's insidious. There's no known onset, but we know that there's chemistry, but sometimes there can be an exacerbating trigger. One time I had a patient who took her grandchildren to the air show, and she was holding her grandchild for way too long, and then she woke up the next morning with frozen shoulder. She probably had a rotator cuff tendonitis, but that started this inflammatory cascade, and her body went haywire and overreacted. I don't love frozen shoulder, but you have to talk about it and you have to make people know what it is. So if they think that they're getting frozen shoulder, they can get the care they need. In Japan, one of the number one symptoms of perimenopause and menopause is frozen shoulder in that country. So in my clinic, I've taken care of women for years and years and years. If I think that they have a shoulder that is trying to freeze, I can tell because they have increased pain, they didn't do anything, and when I go to do gentle range of motion, their shoulder guards against me. Now, in these women, they know me, they're relaxed. Why is their shoulder guarding? It's not them, it's their body being reflexive. The moment we think this is happening, we're going to the doctor. You're getting your blood work done. You talk to them, tell them your PT thinks your shoulder's trying to freeze. We got to check your thyroid. It's time for you to do that hormone replacement therapy. It's time to give up smoking. It's time to start moving your shoulder. So we become aggressive in that way, but we're then making sure people are moving their shoulder daily, gently, especially in the shower, because in that warm environment, you're able to stretch with less pain. Making sure people walk their hands up the wall on the front and on the side. Being consistent with the gentle range of motion, getting your hormones under control, calming your inflammation is the number one way to help your body. So frozen shoulder is the worst. But if you have it,